Welcome back, everyone. The governor of Texas has made national headlines by requiring all girls entering the 6th grade to be vaccinated against the human papillomavirus, or HPV. New Jersey recently introduced similar legislation to prevent the spread of the sexually transmitted disease. And here to discuss the ethical questions raised by this is New Jersey Assemblywoman Valerie Huttle and Associate Director for the Center for Medical Consumers, Maryann Napoli. Good morning to both of you.
Good morning.
Thank you for joining us. And we should mention that the vaccine is important not just because of the HPV, but because HPV is responsible for more than 70% of cervical cancers.
That's correct.
And that is really the key here. Tell us, Assemblywoman Huttle, a little bit about the legislation.
Well, the legislation was recently introduced in the Assembly and the Senate, and we are waiting for committee hearings now to vet the testimony and the questionings of the reasons promoting why this is a good requirement. It has been required by, or it has been recommended by the American Cancer Society, the Committee for Center for Disease Control, and quite frankly, this is a breakthrough in medical history. This is quite frankly a vaccine to save women's lives.
To save women's lives. Now, Ms. Napoli, there's certainly cause for concern. There are many parents, many religious organizations who feel that vaccinating young girls, 11 and 12 years old, against a sexually transmitted disease sends the wrong message. What are your thoughts?
It's premature to mandate this vaccination. It's too new. It was introduced only last summer. And this is an uncommon cancer. It affects, the deaths are less than 1% in the United States. You also want to look at the evidence supporting it. And the clinical trials were done by Merck, the company that makes Gardasil, the vaccine that's being mandated. And Merck says that 21,000 people have been studied in their pre-approval trials. But in fact, less than 1,200 girls who are preteens were in these trials, and they were only followed 18 months.
But Ms. Napoli, what about the thought that if you can protect against a cancer, that you should?
Every medical intervention holds the possibility of harm. And you don't have the full picture of harm until a vaccine has been on the market for years, and tens of thousands of people have received it. It's just too soon. And there's another concern here that hasn't been mentioned, which is that Merck, the maker of this vaccination, has bankrolled the lobbying campaign in Texas. It bought that mandate with its donations to key
do you want to speak to that?
Yes, I would like to also interject that in our legislation in New Jersey, we have amendments for other pharmaceutical companies also being able to, for example, the Smith-GlaxoSmithKline vaccine will be introduced by the end of April and hopefully be approved by the end of the year.
So there will be other pharmaceutical
companies looking
this.
at this vaccine, absolutely. And may I just say that when we talk about cervical cancers, it's the second leading cause of death in women, cancer-related. And where there may not be that many statistics, worldwide there's over 500,000 cases, and actually deaths, half of that. So we're talking about a cancer.
That's worldwide.
And we're talking about in the United
States
States, there's over 10,000 victims of cervical cancer.
No,
well,
that's
the legislation,
not true. That's not true. The death rate and the number of deaths in this country is 3,600, and it's among older women.
Okay, but either way, we are talking about cervical cancer and HPV.
Cervical cancer.
HPV has no cure. Human papillomavirus, also known as genital warts, is an STD that has no cure.
Those 4 strains from the HPV certainly are attributed to 80% of cervical cancer.
Okay, well, the legislation in New Jersey also mandate that 11 and 12-year-old girls entering 6th grade, will they have to have this vaccine?
This will be vetted through our committees, as I said, but there are other states also on this. We look at Colorado, Connecticut, Kansas, Wisconsin, and Michigan, and this is bipartisan support. And there are a lot of legislators getting involved in this. I'm sorry?
Do the lawmakers in New Jersey take money from Merck and other vaccine companies when they decide this mandate?
This is certainly not why we are promoting this legislation. We are promoting this legislation to save women's lives. And may I also say that this also, before we have this recommendation, we will have a public awareness campaign in New Jersey. We will have information distributed to schools. We will have the Commissioner of Health and the Commissioner of Education together partner so that these children and parents and guardians are aware. And the information obviously is the best way to educate the public. I just want to say also that why this is recommended with the ages from 11 through 18, these children, you have to get them before they are sexually active for this to be 100% effective.
She has not answered the question.
Ms. Napoli
of whether,
does raise a question whether
yes.
or not lawmakers who are proposing this legislation in New Jersey have accepted money from these pharmaceutical companies.
I cannot talk for lawmakers. I can tell you that I have introduced legislation. I have not accepted money from Merck.
Okay. Ms. Napoli, thank you very much for joining us. Ms. Napoli, Maryann Napoli from the Center for Medical Consumers, Assemblywoman Valerie Huttle, thank you as well. There is a vote in March.
It will be reviewed in committee, yes, and we hope by March, yes.
All right. Well, thank you very much. This is something we could certainly talk about all morning. Unfortunately, we're out of time. Thank you both. And there's more on HPV and how to treat it on WNBC.com. Scroll down for Today in New York and look for additional information. Rob, over to you.